Harless, and Carrie Drabish asked me to make a video about the disease that I deal with on a daily basis. I have what's called is secondary adrenal insufficiency, and it's also known as Addison's disease. I have the secondary version of it. There is a primary version of it, and my mom and I are going to be talking about some differences with it, and just bear with me because I'm a nervous wreck, of course. So basically, I started getting sick in 2008. I lost a pregnancy, and I had high testosterone levels. The androgens that my doctor had tested were abnormally high. I had a lot of hair on my face, a lot of dark hair on my arms, and he sent me to a reproductive endocrinologist, and she did blood work and diagnosed me with what was called non-classic congenital adrenal hyperplasia, late adult onset. And in 2008, they put me on a low dose of dexamethasone. I do believe it wasn't low when you compare it to hydrocortisone doses, but it was 0.5 in the morning and 0.5 in the evening, which is basically like, I think, probably 30 to 40 milligrams of comparable to hydrocortisone. Within a month, I had gotten my regular cycle back, and then a month after that, I got pregnant with my youngest, and I was on the dexamethasone through my pregnancy and through nursing her up until she was about 18 months old. And then I was told by a different doctor to just go off of the steroid because steroids, were bad for me. I didn't really know a whole lot about the disease. So in 2011, I went off of the dexamethasone. I wasn't weaned off. It was just cold turkey. So when you wean off of something that has been giving, that it gives your adrenals cortisol, it's basically like a shock to your system, and I started getting sick. Some of the symptoms that I was dealing with were I would sleep up to 18, sometimes 20 hours a day. I started losing weight. My cognitive status was questionable at times. And I had two little ones that I was trying to take care of. My husband and my mother, were very concerned. There was even a question of if I was abusing medicine because of how I would present. It was almost like I was drunk at times. They even told me that I would fall asleep standing up. So in August of 2014, I told my PCP, there's something wrong. I'm sleeping a lot. I'm getting sick. I started vomiting a lot. I had diarrhea. And my blood pressure would bottom out. I would go hypotensive, and I would become tachycardic. And I told him, I said, run every off-the-wall blood test you can think of. And I don't care how much it costs. And so one of the first blood tests that he did was an AM blood serum cortisol, and that came back at 0.20, which is the bottom of the bottom. At 8 a.m., your cortisol is supposed to be anywhere from 15 to 20. It's supposed to be the highest in your day. So he automatically was like, we've got to get you an endocrinologist. You definitely have some sort of adrenal insufficiency. And from there, I went through a number of endocrinologists in this area. One of the problems with adrenal insufficiency and Addison's disease is you need to see a specialist, an endocrinologist, but a lot of times endocrinologists are well versed in things like thyroid and diabetes, but they don't see something as rare as Addison's. A lot of times they might have only seen, a patient in a hospital for a study, or just read about it in their textbook. So I was put on hydrocortisone, and I think it was 20 milligrams is what they had me on, and they had me on 20 milligrams. It was 10 milligrams in the morning, 10 milligrams in the afternoon, and I was still getting sick and still not feeling well. And in August of 2015, my mother took me to the Mayo Clinic in Rochester, Minnesota, and we officially got the big official diagnosis of secondary adrenal insufficiency. And we were there a week and did all the testing. And that was another thing I wanted to touch base on was the testing to find out if you have Addison's or adrenal insufficiency is you start off with an 8 a.m. blood serum cortisol, and then you need to have an ACTH level taken at the same time, and that has to be put on ice and sent out. A lot of times people can get diagnosed just from that. People with primary Addison's will have a non-existent cortisol, and then like in the hundreds and thousands numbers in the ACTH. Someone like me who's secondary, my cortisol was non-existent as well. At my test at Mayo, it didn't even register, and my ACTH was, I think it was like a 1.8, and my specialist there told me and my mother that she didn't know how I was even cognitive enough to sit there and have a conversation with her, and immediately sent me to the infusion center and gave me 100 milligrams of Solu-Cortef, and she adjusted my dosing. And then it was another couple years of going through some endocrinologists here, and I'm finally with the one that I have through Cabell Huntington, and she's great. But another thing I wanted to talk about are the medicines to treat secondary adrenal insufficiency. Steroids they're currently the only thing that you can treat for this because you're lacking cortisol. Your adrenal glands sit on top of your kidneys, and one of the main things that they produce is cortisol along with adrenaline, but you have cortisol running through your body and through all your organs every day, all day. Without cortisol, you will eventually go into a coma and you will die. So that's what the steroids treat, is the cortisol. And there's also a steroid injectable, which is used for when you're going into adrenal crisis. When I call it having symptoms of low cortisol, when I'm kind of on the edge, I can feel my body struggle, my blood pressure. Sometimes it'll go stroke level, sometimes it'll drop dramatically. But I always get tachycardic. I have very bad chest palpitations with it. Sometimes I'll vomit, sometimes I'll have diarrhea, sometimes I'll pass out. And that's what that emergency injectable is for. And it currently comes in a Solu-Cortef Acto vial. And it's great at getting you a little stable before you can get to the ER and get an IV, with more Solu-Cortef through your IV. And let's see here, I've got a list, I'm sorry. So obviously with steroids there are side effects, and I'm sure you guys have noticed by now. My mouth, I just had oral surgery not too long ago. Some of the side effects of steroids is bone loss, and it's unfortunate, but there are, it's a better, I have to deal with the side effects of weight gain and things like that, and bone loss. It's either that or the alternative, and I'm kind of happy with my life here on the earth with my babies. But I had I had a beautiful smile, and the steroids just did a number on my mouth in the last probably 2 years.
Yeah.
And recently had all that taken care of, but I also have a tremendous amount of bone loss with my jaw, and I have to go in and have another surgery done, and to deal with that. But I will be getting my smile back soon. It's just a little embarrassing. I also wanted to talk about how with secondaries, there is sometimes a chance that you can be able to wean off your steroids. When I had gone to Mayo Clinic, that was the original plan, and they tried to wean me off steroids probably 3 different times, and 2 of those landed me in the hospital, one with an ICU visit. I would basically get down to 10 milligrams, and then my body would just say enough. It's you can't always wean off of steroids. For me, where my secondary is permanent, I don't have tumors or anything on my adrenal glands, but my endocrinologist believes that my adrenal glands are atrophied, which basically means that they're just kaput. Also, I wanted to talk about with someone who's adrenal insufficient, you don't have the cortisol in your body to deal with stress, whether it's a good stress like going to my sister's wedding, or having a nice, fun day with your family, a family gathering, or a bad stress like a death in the family. Emotional stress is very taxing for someone with adrenal insufficiency, whether they're primary or they're secondary. When my grandmother passed away, I got very sick because at that time I didn't really know what's called stress dosing within our disease, and it's basically when you're dealing with good stress or bad stress, your body needs extra cortisol to be able to handle it. And I didn't learn about this through doctors. I learned about it through a Facebook group that I belong to. It's called Adrenal Insufficiency Support, and it's supported by the National Adrenal Diseases Foundation, the NADF.org, I think is what the link is. But basically, now doctors will say if you have a fever, then you need to double, sometimes triple your regular steroid dose. Someone like me, I'm on 30 milligrams of hydrocortisone a day, and I take it split up in 3 doses. I take 15 milligrams as soon as I wake up in the morning. Usually it's between 4:30 and 5:30, and then 7 to 8 hours after that I take 10 milligrams, and then when I go to bed at night I take 5 milligrams, so I have that steroid cover through the night. So when stress dose, when I'm sick, I just got over a cold, I had to double my dose for 2 days, and so you just double the amount. But that's so your body can handle the stress that the cold virus is being put on you. Also, there is, and then when you come down off of your stress dose, if you've been on like a high triple dose, you kind of have to wean yourself back down. So it's not such a jolt to your system, because if you come back down too fast, that can put you into adrenal crisis, and then you'll end up back into the hospital all over again. It's basically been a big learning curve with having this disease, and I wanted to touch base about when I had my oral surgery. My endocrinologist, made sure to talk to the anesthesiologist anytime someone with adrenal insufficiency is going to be put under. They need the 100 milligrams Zoleucortef put into the IV so their body can handle the stress of it. And then if you're in pain after, a certain kind of surgery, that's obviously stress on your body, so then you have to updose for that and then slowly wean back down to your regular dose. Also, steroids, another bad effect is it can make your immune system weak, And a lot of times when, especially now during flu season, I mask up whenever I go to a doctor's appointment, or if there is a big group of people, or if I'm around younger children with all kinds of germs, because your immune system is just, it doesn't work as well as it should. I'm trying to think what else I need to talk about. I asked my oldest daughter, my 13-year-old, what she wanted, for me to say, if there was something that she could tell people that were, learning about this disease, like a nurse or a nurse practitioner or a resident or PA or anything. And she told me was that, people with adrenal insufficiency are rare patients. And a lot of times, if you're working in an ER later on after you graduate, you will come across people who have rare diseases, and it's okay if you don't, know about someone's rare disease, because I was just in the hospital for an adrenal crisis at the end of September, and the nurse and the ER doctor both were like, hey, we're learning all kinds of stuff about you. I will freely admit that you probably know more about your disease than I do. I'll have my mom touch base about ER experiences and things like that, because normally when I'm that sick that I need to be in the ER, I don't really remember things. That's another thing when someone with adrenal insufficiency is going into an adrenal crisis. Sometimes it can appear like I know with diabetics, their cognitive status can be affected, and that's definitely true for someone with adrenal insufficiency. And then your blood pressure is typically low with adrenal crisis, but there are times when my blood pressure has been stroke level, and then just the very next minute I will tank out and it'll be hypotensive, and then I'm tachycardic. My heart has it'll go on runs into the 180s, 190s. It'll palpate really hard, and then I have pain in like my kidney, my flank area. It's just some of my rare symptoms. And
about lupus.
Lupus, well, there's also things that I deal with. Another reason, the reason why I'm on 30 milligrams a day, and I have put on 80 pounds in the last 2 years, because my steroid dose is higher. Typical steroid dose for people is like 15 to 25 milligrams. My body is under a little bit more stress than someone who doesn't deal with some of the other issues. They currently think that I have some form of colitis. They're not for sure because of the I still have to have a couple tests, but I have a lot of bowel issues. I have nausea every day of my life, vomiting probably once or twice a week, and then I also have heart damage from the adrenal insufficiency and the steroids to my body. They currently are, I have to get into a rheumatologist to have some testing with lupus. And then that's something I'll mention at the end. But also, when you're dealing with a chronic illness, you deal with anxiety and depression, because on a normal day, I wake up in between 4:30 to 5:30, and I have my steroids right there with my water, and I take my steroids first thing, because when you are adrenal insufficient, you basically wake up feeling like you have the flu every day. Today is a good day. Today I have my makeup on and something other than pajamas, but most days am very run down. There are some days that I cannot get out of bed. There are some days that my husband has to help me shower. My mother drives me to my appointments and, to the ER, and she stays with me in the hospital. She takes care of my girls when they have appointments sometimes I'm able to ride along, and sometimes I'm able to go into the appointment, and sometimes I can't physically do it. So my mother helps us out with that a lot because of how taxing it is on my body. It's just, when someone says that they're tired, the kind of tired that I'm talking about with adrenal insufficiency is like bone tired. Like, it's just like it never goes away. Like, I always feel tired. I always feel run down. The only thing I can compare it to is when you have the flu. And when you have the flu and you kind of feel like you're moving in slow motion, and at its worst, I'm in bed or I'm in the hospital, and at its best, I have my makeup on and an outfit on with no PJs.
Oh, if you want, that's kind of backtracking.
I'll have you talk about that.
Okay.
So my mom is, she's like a huge help to us, and she's the one who's with me 9 times out of 10 at the hospital. And I just kind of wanted to have her talk about, our hospital experience, or how she, has seen how it affects, our lives, or whatever else she wants to put in, because we're just trying to get the word out about this illness, because it is rare, and it is a struggle to deal with on a daily basis. But thankfully, I've got great doctors, and I'm thankful for Miss Carrie that she wants to educate about it. And so here's my mom. Her name's Pat.
Hello. She said that, well, it's not only just me, it's her sister, her
My
husband.
sister.
It takes almost the whole family, because she's got 2 daughters, and we just jump in and know what to do. There's been many times I've gone down to the ER and waited for a family member to bring her and drop her off. We've got notes on our...
It's been a big learning curve.
Yes, it's taken a long time
Yeah.
to learn. But we've got notes on my kitchen here, and my other daughter has notes in her phone on, what to do, what to give her when she gets to a certain point, how many of her stress dose to give her. She might need a stress dose.
Of like 20 milligrams.
Right. She might need
Pill
that.
form
Pill
instead
form.
of the Solucortef
Instead of
injectable.
The emergency injectable. I've got notes. My other daughter has notes. I might add that her husband is awesome. It's been a learning curve for all of us before we even knew what was going on. What year was that? She spent a week in the ICU and doesn't remember it.
Yeah,
And
that was in the end of 2013.
And that was right after the doctor just wasn't versed in steroids, and he just had her quit cold turkey. And then slowly but surely, this is where we ended up. We've had to train we sat down and we've showed her 13-year-old daughter and her husband one day a few weeks ago
how to give me the emergency injectable.
And she was not really, she needed it, but she was really kind of out of it, and we had, her husband and I did it together and showed her 13-year-old.
Yeah.
And showed her how to do it, because she can just hit the floor.
Yeah.
And they're just a couple doors up from us, and she knows not to call me, you do the dose.
Right.
right away. And there's YouTube videos, instructions. I've watched it a couple times on how to do those injectables, and Aaron showed me too.
And that's another thing with the National Adrenal Diseases Foundation. On their website, they have links to those videos about how to give the emergency injectable, and when to give it and why you do it, and then you get to the ER afterwards.
Right. Getting a trip to the ER, we drive her. We don't call the ambulance because time is of the essence with this, and we've learned that from.
Had to learn it the hard way.
Yeah, and we learned it from her page on Facebook. That group has been tremendous.
Yeah.
There's doctors on there, PhD, nurses, nurse practitioners. We've had to learn. It's also been a learning curve. At the ER, what we're seeing is your older doctors are just versed in regular Addison's.
Right.
And they
primary,
and they just think that she needs to take 10 milligrams just during the day, and they know nothing about stress dosing.
Right.
But what we're seeing now with the ER visits is the younger nurses and really the younger doctors are, you can see now within the last year, we've noticed they've really been getting trained in this.
Yeah.
And we've had some pretty good results with it. Like she said in September, the nurse was just infatuated with her. But one thing I've learned to do is speak up. And once they realize that they know that we are knowledgeable about this disease, and it is life-threatening.
Well, we've had some nurses that take offense to my mother being like, my daughter needs this cortisol. She needs an IV. She needs cortisol, 100 milligrams, so you cortisol. My daughter really needs this.
And I just have to get very blunt. And it's like, if she doesn't get this, she can die.
Well, and then a triage nurse, told my mom the last time, well, the beds are full. It's going to be a long wait. And my mom was like, that's not acceptable. I need you to talk to the ER doctor.
And he
knew us from before.
Right.
He had treated me before, took us right back.
We learned how to be pleasantly pesty.
Pleasantly pesty
is the word we use.
Yeah. And then they normally realize, we're not there to tell you how to do your job or to be rude or any. It's just my mom in that moment is trying to keep me from going into a full adrenal crisis where I would end up in the ICU, and organ shut down and possibly a coma and then death.
We've just learned this, and we just again do appreciate you teaching this at UC, and how many more generations down the road that will benefit from this. But one thing I noticed, they were going to give her a good dose of her emergency the last ER visit, and the nurse was awesome. And he said, well, you're gonna have to stay the night. And he goes, and I'm gonna give you this emergency dose now. And then he said, what'd he say? He goes, then we'll just start you over on your regular dose tomorrow. And Aaron, we looked at each other and got kind of quiet, and I go, you can't do that.
Yeah.
And he knew us by then, and it was like,
a lot of times they want a dose every 12 to 24 hours.
Yeah, so you've given her this emergency dose.
I still need my regular.
She still needs her regular. And he just was.
And when you're in crisis like that, it needs to be doubled or tripled. So
right.
We explained it to him.
So and then the residents came in, and they were infatuated with her and just wanting to learn. One resident had Crohn's, and then I had one resident. You can see a lot of them. They look at her and they think she's obese. She's got an eating disorder, They look at her, and she's even been accused of, not having Addison's. There's nothing wrong with her.
Yeah.
And the last time we were there, one of the residents asked me, and I pleasantly answered him, and he said, does she have anxiety and depression? I said, yes, she does, because of this disease. and I know they're in teaching, but you can't deal with what she deals with and not have anxiety and depression.
And a lot of times, it's meant well, but I always, when I'm talking to someone who's a resident or who's learning about it, I always tell them, my Addison's might not be the reason that I'm sick. Like if I'm in there with a stomach virus, my Addison's didn't cause this, but what it all boils down to is it's going to affect it.
Right.
And, regardless if you give me Zofran and medicine and things like that, my body's still going to need those steroids because of the stress on my
simple
body.
cold, she has to updose even with a simple cold.
Yeah.
And one thing that I'd like her to touch on too is that on the Facebook group that she's on, there's several that they're doing clinical studies on a pump.
Yeah.
They're using a diabetic pump.
They're using insulin pumps, and they're putting the liquid Solu-Cortef in, and it's a continuous throughout the day kind of infusion, like it is with, certain diabetics. They have that insulin pump, but they're doing studies. They just got, they just shut down for the people to sign up at the Cleveland Clinic had a study. I think Johns Hopkins has a study, and then I know there's some endocrinologists in the South and in Michigan and Ohio that are doing pump studies for their patients, and it's something that I definitely, and my endocrinologist is interested in it as well, so we're gathering all the information and going to go from there, because I have friends that have been on higher doses than even I'm on. I have friends that have been on 60 milligrams of hydrocortisone a day, and they're able to get this pump, and through that they're able to get down to like 20 milligrams so it's like equal to 20 milligrams of hydrocortisone with the Solu-Cortef.
And they've lost weight.
And they're able to lose the weight that they put on, and then other things come into play. It's not as hard on their heart because of the steroids and things like that.
Yeah, it has affected her body.
My whole life, my whole body has changed.
Everything's changed.
Everything is completely changed. The shape of my face, obviously because I've got bone loss, and then I've got the side effects of the doses where it's higher, where I have to be on it because of my bowels and things like that. It's hard on my body, and it's hard to when you see people that you've known your whole life and they don't recognize you. Unfortunately, it's just something that you have to deal with, and I'd always tell Mom I would much rather be fat and alive than dead and skinny, and eventually I know that the weight will come off again. I've lost weight like this before, but it was when they were trying to wean me off and I got really, really sick. But this time I'm hoping we'll get the pump and we'll be able to manage it like that.
But the big thing I can stress is they need an advocate.
Yes. Yes.
You have to have somebody advocate for you, because the last trip to the ER, she doesn't remember going in.
I don't remember going into the ER.
No.
And she was with me until they got my dose and everything right, got me in a room.
Yeah.
Goodness, we were probably in the ER
we were in the ER 12 hours before she got into a room. But we just learned what to do. I mean, I'm right there beside the nurses helping them, and we've just learned a lot. And her sister has taken her before and spent the night with her before too.
But you need an advocate. You need a really good PCP to help coordinate when you're in the hospital, and you need an endocrinologist that knows about adrenal insufficiency or someone that's willing to learn.
One thing that we found out, that the older doctors, not to be downing their training or anything, but they're not versed in stress dosing.
Yeah.
She has her normal dose that she takes every day, but then she has stress dosing.
A lot of times the older doctors only want you to stress dose if you have a fever, and it's just not the case.
But a stress dose, if she feels good,
Mm-hmm.
she might go out with me. We might go out to eat,
Mm-hmm.
but that's gonna using
affect me.
It's gonna affect her. A good day can still going out is still gonna affect
Good
her.
stress is still bad stress.
It's still
on my
stress.
body.
It's still using that. So we know the next day she's gonna have to updose some. She's gonna have to stress dose.
Right.
So is that all you wanted me to do?
I think that's really all that I wanted
Oh
to
my
talk
goodness,
about.
and we sure went over.
Yeah. Carrie, edit this however you want. It is like way too long, and I was totally stressed out about it, but here you have it.
She did good.
You can cut out whatever you want.
And good luck, nurses. Thank you, Carrie.
Yes, thank you, Carrie, and thank you for asking me to do this. I really appreciate it. I know I post some things on Facebook. I don't post everything, because if I posted about how I feel, that it'd be like a different thing every day. But thank you for asking me to do this, and thank you for thinking about the disease that I deal with, and I appreciate you.
Thanks. Bye.